Hello and welcome to today's episode. Today we are continuing on the episodes that we've been having on infertility. Today we're going to talk about a very touchy topic, and that is cancer and fertility. That is, how does cancer interact with fertility in terms of the diagnosis, in terms of the treatment. Is it possible for a woman or a man to go back to fertility after treatment? So to start us off, we are going to have a recap of what type of cancers would generally affect fertility in human beings, in males and in females. Mostly these are reproductive organ cancers. In women, we are talking about vulval cancers, talking about vaginal cancers, cervical cancers, uterine cancers, ovarian cancers. You are talking about breast cancer. Although at the same time, the other types of cancers also do apply because they involve the area of the pelvis, so the treatment done there may also affect fertility. Here you're talking about colon cancers or anorectal cancers. Those are cancers involving the gastrointestinal, the food system, the food digestive system. That can also cause issues with their treatment. Of course, the other cancers also come into play. All the others, they're involving the body may be weakened in one way or the other, and the treatment may also cause infertility. In men, the commonest is prostate cancer. Luckily, in quotes, it tends to affect much older men whom presumably would have been done with fertility issues, but nevertheless, treatment of prostate cancer does affect fertility. The other types of cancers, just like we've said in women, in terms of colon cancers, anal cancers, liver cancers, stomach cancers, and all those other types can still affect fertility because of the type of treatment which has been given. So generally speaking, and here we are talking in terms of general terms, cancers are treated in three main ways. One is surgery, two is radiotherapy, that's where we use radiation energy, and three, we may use injections or tablets, which we call chemotherapy. So we have surgery, we have radiotherapy, and we have chemotherapy. All these can actually affect fertility depending on what type of cancer is being treated and how these treatments are being given. Now, I'll take you quickly in brief. Surgery, sometimes a woman may come to us and has been diagnosed with cervical cancer. And in that case, she may be a young woman, and we see that quite often. And she maybe hasn't gotten children and wishes, of course, to preserve her fertility. So long as the cancer is early stage, we could be able to preserve the uterus. So we are able to do procedures like what we call trachelectomy in medicine to remove all the cervix and maybe the lymph nodes which need to be removed, but preserve the uterus and the ovaries, which can actually carry a pregnancy after the treatment. But that has to be very early cervical cancer. Sometimes a woman may come to us with uterine cancer or ovarian cancer on one side, and she may still be young and she may want to preserve some level of fertility. Now, in those cases, we may not be able to, when we're doing surgery, we may not be able to preserve the uterus, and we may actually also not be able to preserve the ovary. The type of surgery that may be required may necessitate that we remove the whole uterus and cervix, the whole and both ovaries in that particular case. Now, in those cases, how do we preserve fertility? Now, in those cases, we could, if it's very early disease, and I have to hasten to say it has to be early disease, early cancer. In those cases, then, we could give a cycle of ovulation induction. So we give medication to ensure that she ovulates many eggs in that particular cycle. And once she's about to ovulate those many eggs, we harvest those eggs. Now, once we harvest those eggs, we put them in a test tube or a petri dish, and we can do two things to it. We may freeze those eggs to be used in future by herself, or if she has a partner, we may fertilize all those eggs in the lab and incubate those fertilized eggs up to around 5 days. By the 5th day, you find the embryos are actually ready to be transferred back to a woman for fertilization. But in this case, we freeze those embryos. So 1, I've talked about egg freezing. 2, I've talked about embryo freezing after fertilization. Those are available in this country. But there has to be very strict criteria for one to qualify for that, because we also don't want to delay the treatment as we do this type of fertility sparing. Now, the other one is also to preserve ovarian tissue. Ovarian tissue can be preserved, and that can be used later in terms of fertility, that is ovarian tissue preservation. That is not very well developed locally, but it's available elsewhere. Now, that is insofar as surgery is concerned. In males, and especially in prostate cancers, that is usually handled by urologists. They do advise in terms of the role of removing the testes, because that is sometimes one of the options, what we call medical castration or surgical castration. Either we give medication to disable the testes from producing any hormones, or physically or surgically removing the testes. That is usually done by our colleagues, the urologists. Now, the other bit is chemotherapy. Those are the injections or tablets that we give to treat cancer. Now, some of them may affect fertility irreversibly. They may affect the ovaries so that one is not able to produce eggs in future, or they may affect the testes so that the man may not be able to produce sperms after the treatment. But a number of them, one is able to still ovulate late after the treatment, although the level of fertility does reduce with continued use of chemotherapy. And after completion of the chemotherapy and the disease is under control and the patient is on follow-up for some time, and we are sure she has gone into remission. Remission is the medical term of cure, because cancer, we are not sure whether it will come back and if and when it may come back, so we talk of remission. Then in consultation with her doctor, we may advise that she can actually conceive, but most often this has to be after some few years, maybe depending also on the type of cancer. There's some types of cancer after 2 years we may allow them to conceive, others it has to take even up to 5 years for us to know that we are clear, for us to do, for the woman to have a green light to continue with her fertility. Now, the last bit which I would like to talk about is radiotherapy. radiotherapy affects fertility the most. And that's because radiation energy, once it hits the ovaries, once it hits the testes, it tends to unfortunately sterilize those organs. So if there is radiotherapy to the pelvis and the field of radiation includes the ovaries, invariably you may find that the fertility drastically drops. And in a man also, if there is radiation to the pelvis, most likely the sperm count will drastically reduce. Although there could be a level of shielding, especially of the testis, scrotum, level of shielding to assist preserve the fertility of the male. So it is possible, and it is actually done, that during radiotherapy those can be shielded so that they don't have maximum heat of the radiotherapy. But because of the conditions which come with radiotherapy, the side effects which make the tissues to change, the pliability and the like, find that fertility may still tend to be affected the most during the time of radiotherapy. And that is where the egg preservation comes in, the embryo preservation comes in. In a male, of course, we didn't talk, but we are talking also about preservation of the sperms, which we can have them stored in a sperm bank until a time when they are required. Now, we've been talking about cancer treatment and fertility. But in the background of all this, when we are preserving fertility, the most important consideration we have is the life of the individual. So the preservation usually comes as secondary to the health of the patient. So we usually would not want to delay treatment as we pursue fertility preservation. But all that done and said, it's usually a discussion between the doctors ourselves and also the couples and the families on how to support the patient in pursuit of fertility preservation. Don't forget to subscribe and also share. This information may be important to somebody else. It may help somebody else out there. This has been Dr. Orora Maranga, gynecologist and cancer specialist, 𝗳𝗵𝗁𝗲𝗄 in Nairobi. Thank you, and see you next week for the last episode.